All right, good afternoon, everyone. Thank you for coming to our Vape panel. We hope you take away something educational from this experience. We know you all have very, very busy afternoons and obviously work, and I see some students here, so thank you for also bringing your students. This experience obviously is very, very important to me because I deal with this on a daily basis. My name is Steve Lucas. I'm the Dean of Students at the high school here. And the people that I have before you obviously are all people taking time out of their days away from their families to be with you. So I hope the information they provide you is worthy. I know they're very important people in terms of losing you guys. There you go. Very important people. I'll let them kind of introduce themselves as we kind of go through here. And so because this is a Q&A panel, we do hope that you have some questions for us, okay? What I'd like to do is I'll start by handing this over to Officer Goshi. She's going to explain some stuff to you. After we get through this panel, you guys will all have the opportunity to go into the cafeteria and then have a sit down individually to where you guys can get more information, as all of these people have some information to share with you and what they do specifically, and resources, supports, things that they would have available to you guys, okay? So I'm going to see if you guys have any questions before we begin, but as you have these people before you kind of explain, and as you're getting this information, if you have questions, please don't hesitate to raise your hand and they will call on you, okay? This really is for you guys, so please don't feel bad if you have to stop us at any time, okay? If you don't feel like, because this is sounding like a little bit choppy, if you need it, obviously you can use your coaching voice, okay? So, all right. I will transition this to Officer Goshi.
Good evening. My name is Jamie Goshi. I am a detective and a juvenile officer with the Batavia Police Department. While I have a lot of information I would like to share with you guys this evening regarding different types of vaping devices and what's popular with our youth today, I do think it's important that we spend more time with the panel learning about the consequences, health risks of vaping that the counselors and the medical staff have to share with us tonight. I can tell you that the Batavia Police Department has taken a lesser disciplinary or punitive approach to dealing with juveniles that we find in possession of tobacco products when appropriate. We find it very beneficial and important to provide resources and assistance to juveniles and their families to programs that we have in the community to educate them on the dangers and health risks of vaping. And to encourage them to stop the behavior before it becomes a bigger problem. So I do want to invite you all to meet with me after the panel. I have numerous vaping devices that I could show you, photographs to share, and I can take time for any individual questions that you have. And I want to thank you for having me this evening, and I look forward to meeting with you all. I could take any questions now if you'd like, otherwise I can pass it along.
Thank you, Mr. Lucas. I'm Kim Boatner. I'm a private practice clinician. I'm a licensed clinical social worker and a certified alcohol and drug counselor. And I have my own practice in Geneva, as well as I've been supporting students here with the Batavia School District for the past 5 years. And it's wonderful. I come in and support students and families with restorative discipline practices around substance use. So if a student were to be struggling with substances, be intoxicated at school, or be found to be in possession of a substance, obviously the dean and the team of related services get together and see if it would be a good fit, if I could do an assessment and recommend either following up with them myself here at the school, or I refer them out to different programs in the area. As well as I run a group over at Mid-Valley Mates Johnstone School in St. Charles for middle schoolers. That's a prevention and education group based around resilience. It's a lot of fun. And then I'm on several task forces here in the community. So I love doing these. I love the opportunity to talk to you all, and I thank you all so much for coming tonight and for inviting us here as well. So like Officer Goshi, I'm so sorry, Goshi said, you know, the vapes have changed quite a bit. We're kind of on the 4th generation of vapes, and you know, they used to be really big and bulky. Think of a cell phone, Zach Moore's cell phone versus the cell phones of today. You know, like back in the 90s versus now, they're always changing. And so one of the hardest things about trying to educate parents and families and students about vapes is that they change all the time. So probably in a year from now, you won't see any of these, because that's just how fast it goes. And I encourage you to go and step over and take a look at what some of the devices look like. I took a lot of the information I wanted to share with you from the CDC. Came out with its first report on vaping and the impact, the health impact on our country, and also on young people. And so an e-cigarette and vaping, a lot of times those words are used interchangeably. It used to be that a vape pen was what they're sometimes referred to, were strictly kind of in the nicotine category, and you had what are called dab pens, which were more in the THC category. That's the active ingredient in marijuana. But now they're all interchangeable. So it kind of, a lot of the language, it's even hard for us to keep up as professionals. The liquid or juice or pod or cart, a lot of times they're called vape carts, dab carts. That's the actual substance that's put inside of the vape device that contains the liquid that's inhaled. So that's sometimes what it's referred to. A lot of these products contain nicotine, and a lot of them also have THC. The ones with THC have been found to be particularly harmful, especially in the study the CDC just did. And in November, when they came out with this, they found that a lot of the THC vapes, when inhaled, creates this chemical, or it's a byproduct of vitamin E acetate, and I know that's going to get real technical here, but basically vitamin E is in everyday products. It's in our skin creams, it's in our food, it's additives. It's not harmful at all if you consume it or put it on your skin. However, when you inhale it, it tends to really damage your lungs. And so that's the problem with a lot of these vapes. You're hearing about vaping deaths across the nation. The research is showing that the chemical responsible, or the compound that's responsible for that, is vitamin E acetate. Because it is inhaled, it creates, it really just damages your lungs, and you can suffocate that way. So the vitamin E acetate can be an additive found in nicotine products, non-nicotine products, THC products, non-THC products. They're really finding there's a strong correlation with the THC and the lung damage. However, there's also been cases that they found that there was no THC inhaled by the person who got the lung disease. And another hard thing about the vitamin E acetate is that none of these things are regulated yet, really, by the FDA. So people may not think they have nicotine in them because they say they don't. Nobody's monitoring that. Let's see, I'm just going to skip through here. So there's been 68 confirmed deaths as of February 18th. So that's last week and a half ago. Yeah, so it's pretty up to date. 2,800 hospitalizations. One of the things that I found particularly troubling is that, right, we know marijuana is now legal in the state of Illinois. It's not a really big newsflash for anybody, but a lot of these dispensaries that are selling these vaping products with THC in them that people are purchasing legally, they also have that compound in them. So the CDC, when they were talking about their report in November, they said that these dispensaries that are legal for people to purchase, these vaping devices with THC in them, and the person's over 21, and it's all legal. These things actually can create severe lung damage to the point of death. So they said that may be intentional by some of these companies that's in there, maybe unintentional. They don't know, there's not enough research. Every state regulates THC in a different way, so it's very hard to get any data on this because it's changing all the time, and every state's doing their own thing. Illinois is one of the leading causes, or leading states for deaths. I believe it is up to 6 now. We are tied with Indiana and Georgia. So you can see it's kind of interesting. You think about California, it's been legal, longer, and Colorado, it's been legal longer, but we actually have more people dying in our state from using these products than most of the country. And most of those people happen to be, under the age of 24. So a lot of times people, when I was growing up, smoking's bad, right? We know smoking cigarettes is bad. It'll give you, cancer, and it can really harm you later on in life. But this is working a lot faster, and it's killing people a lot faster rate. So you can see the overall impact, and why I wanted to show this graph was it's impacting people way more that are under 18 and that are 18 to 24 than it is even people older than that. And you can't purchase these products unless you're 21. So that's the ratio of how many people are hospitalized. How is this happening? They shouldn't be able to access these things. Another finding, this is not a reflection of Batavia schools or anything. This is a nationwide statistic. So in 2017, if you look at 12th grade, 11% were using it. 2 years later, we're at a quarter of high school seniors said that they've used a vape product containing nicotine within the last month. And I don't doubt that number may increase, just given the trend here. So for the students that came here, I'm so glad to see you. A lot of you guys that you may know somebody that's used this before, or you've come across it. People don't know what are in those things that you are vaping, because so-and-so took a hit off of so-and-so's, took a drag off of this one. Hey, can I hit your vape? They don't know what's in it. And what was really alarming is that if that last statistic, the research conducted by a New England Journal of Medicine found that 99% of all e-cigarette or vaping products sold by a retailer contain nicotine. Yet if you go walk into any vape shop, you'll have a whole selection of zero nicotine products. But again, they're not regulated. So it could say there's no nicotine in there, and it could have 50. We don't know, right? Because that's not, the products are coming out way faster than regulations can keep up with. So a lot of times when I'm talking to kids, they'll say, yeah, but it doesn't have nicotine in it, so it's not harmful. Well, it says it doesn't, right? But most likely it does. And so that's something that takes a lot of kids by surprise. Well, no, it doesn't. It says it doesn't. Okay. It can kind of say whatever it wants because no one's watching it. So some ways for parents to talk to, your kids about this is to make sure that you guys do start talking about it. That's why I love that I'm seeing young people in here today. This is something that's around all the time. They're seeing, kids, you're going to see them, kind of wherever you go. They're going to be out and about. I'm sure people have seen people using vapes just in, walking in and out of the grocery store or whatever. They're around. And so creating an environment that hey, if you're tempted to use this stuff, talk to me about it. I'm not going to punish you for wanting to talk to me about it. Or if you did use this and you feel like that was a really bad idea, talk to me about it, right? Creating an environment where there's open communication, free of judgment and shame. Lecturing does not work ever. They just turn off. They're lecturing me about it. It's bad for me. It could kill me. Blah, 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 blah. That usually doesn't work. But express your concerns, but say, hey, I don't want this to limit you in all the things you do want to do. And this sounds like this could be if you play sports, your lungs aren't going to work the way you want them to work because it's going to be harder for you to breathe, even if you don't get this horrible lung disease. And then reaching out to your school, to your church, to your doctor, asking for resources if you and if your family and your child need them.
Did you not need that?
All right. Hope everybody can hear. It was really.
All right, hi everybody. I am Dr. Kate Sunderbrook. I'm a pediatrician and a medical director with VNA Healthcare. And I'm here to sort of talk and expand on a lot of the health risks associated with vaping. Certainly touched on the big story of last summer, which was the vaping associated acute lung injury, which was associated with THC, nicotine, vitamin E, and vaping products. There has been a bit of a decline due to the awareness of the vitamin E toxicity. A lot of producers of e-juice are voluntarily removing vitamin E from their products because they don't want to kill people, at least not like right away. So that has shown at least awareness of this possible correlation, but it is still, like she pointed out, completely unregulated. You have no idea when you buy a cartridge, especially if you buy it from a vape shop or online, literally no idea what could be in that cartridge. And because the cartridges contain high amounts and inconsistent amounts of nicotine, the amount that you are inhaling when you vape can have a big range of effects. Juul in particular typically has twice the nicotine that other vape type cartridges have, which cause a faster uptick into the brain. And the pediatric brain, the brain under the age of 25, is particularly susceptible to nicotine. You're about 5 times more likely to become addicted to nicotine if you take if your brain gets its first hit of nicotine under the age of 25 than if it does after the age of 25, which is why you don't meet a lot of people who say, oh, I started smoking in my 30s. Most people start when they're young and then continue a habit that they can't break. Another sort of hidden danger of e-cigarettes and cartridges, especially in families that have older kids and younger kids, that the typical e-cigarette cartridge contains 100 milligrams of nicotine. A fatal dose if ingested orally is about 10 milligrams of nicotine for a small child. So if you have a younger sibling who gets into older siblings' room, starts messing around with their stuff, gets into their e-cigarette juice, could easily consume enough nicotine to receive a fatal dose without really anybody necessarily knowing what they were getting into. A lot of e-cigarette products now are required to have child-resistant packaging. Anyone who's ever been a parent of a small child knows child-resistant does not mean child-proof by any means. And small children can get into harmful products really quite easily. And we know that vaping type products, e-cigarette type liquid, is primarily found in the homes of younger people. Like you said, it's gone from 1% to 2% 8-10 years ago to now 25% of high schoolers experimenting with these kinds of products or using them on a regular basis. So it's definitely something that are in homes with older kids, in homes with younger kids, and can have, certainly not only a individual health impact on the person who's smoking, but sort of expand and harm a lot of the impacts that a lot of people have been working on with the American Lung Association to reduce smoking type behaviors. We sort of all grew up knowing that smoking was bad, and a lot of that knowledge is, you might know that smoking a cigarette is bad, but a lot of people don't associate vaping with that same kind of negative connotation. So it really normalizes this kind of behavior. And vapes have only been available in the United States for about 13 to 14 years. They were first introduced in the United States in 2006. It's a really sort of uncontrolled experiment to see what kind of problems it's going to cause. It took generations for the problems of tobacco to really come to light, to make the public aware. And like last summer showed us that there are, acute health risks associated with vaping, but we really have no idea what the long-term risks of this aerosolized product is. One common misconception is that e-cigarettes let off water vapor. It is not water vapor. It is a chemical vapor that has byproducts of nicotine and also the byproducts of whatever is being burned in that cartridge, which you don't really know. Common additives are like antifreeze type products to keep it very liquid so it doesn't freeze. But breathing in antifreeze byproducts tends to not be good and is a known carcinogen over longer terms. But again, we don't really know what the potential secondhand vape associations are because it just hasn't been prevalent in the United States long enough for any of us to really know what any of these long-term implications are.
Thank you. Thank you. Well, that was great. Thank you for giving a great introduction into what vaping is. I'll introduce myself. My name is Becky Kovac, and I'm the Trauma and Pediatric Coordinator of Emergency Services at Rush Copley Medical Center. And I've been in emergency and trauma nursing for about the last 20 years. And I just want a show of hands. How many of you heard of vaping 5 years ago? You did, okay, 10 years ago. Kids, what about you? How many of you heard about it 5 years ago? How many of you just started hearing about it in the last 2 years where it became really, really well known? Okay. So you have to understand that we have seen this uptick in vaping because of how it's been marketed in our society, okay? Now, vaping follows a course through history, okay? And it all started with smoking. And smoking has been around this world since the early ages, okay? They say it traces back to 6000 BC, okay? Then you have Christopher Columbus, who sailed over here, okay, and discovered tobacco in Central America and actually then brought it to the Americas, okay? And tobacco kind of was used for a long time in religious and different cultural traditions where it became really popular to smoke it. And then as tobacco became more abundant in the U.S., because in North America, it's very abundantly grown. And so it was used as currency in North America. And those that could produce a lot of it were the wealthy. And so Jamestown, Virginia, during the 1800s was a big hub center for tobacco and its mass production. And smoking originally was only for the very wealthy because at the time you could only hand roll your cigarettes. But then this guy came out and created the tobacco rolling machine, okay, where you could actually, the cigarettes were now mass produced and they became cheaper and everybody could smoke them, okay? And then Let's fast forward to World War II. It was, I don't know if you guys noticed, but it was actually the Nazi scientists and doctors that actually linked smoking and tobacco use to lung cancer, if you can believe it. So I'm not going to give them a high five for anything that they did, but it was actually them that started to say, hey, this could be really bad for you, okay? So we're in about the 1950s now, and this is what we call the baby boomer generation. So kids in here, this is your grandparents, and maybe some of your parents, okay? And smoking was sensationalized by who we call big tobacco, okay? And big tobacco was able to put out all these wonderful commercials in the 50s and 60s about smoking. So it was sensationalized. Who remembers the Marlboro Man? Good looking guy, right? I mean, he smoked on that horse. He looked good, right? Okay. Who remembers the movie Grease? Who didn't want to be Danny and Sandy, okay, with a cigarette hanging out of their mouth or a pack rolled in, okay? So this is how big tobacco pushed their product out to your parents and your grandparents, and guess what? It worked, okay? So the government and the CDC had to get really smart on how are we going to fight this? Because now let's jump to the 1980s, okay? And now they're seeing, our parents, the baby boomer generation is saying, our parents are starting to get cancer. What's going on? So the CDC started coming out with public service announcements. Anybody remember watching PSAs in the 80s? Okay, public service announcements where they actually showed the negative effects of cancer. And guess what? our and the children started seeing our parents with all these problems and seeing these public service announcements, and we all said no way to smoking. And so it worked. The PSAs worked. And it worked for about, as of 2015, smoking was at its lowest point in high schoolers that it had been in a long time, okay? So what do you think Big Tobacco thought of that? They came back and said, So it is Big Tobacco that started sensationalizing the vaping or the juuling and coming out with all these really attractive products and cartridges that were seen earlier, okay? And so you could get it in any color, you could get your juice in any flavor. I could have Jolly Rancher vaping, I can have green apple, I can have Kool-Aid flavor. So what do you think it did to the youth here? Do you think it worked? Yes, it did. It worked. So they are estimating that there are about 3.6 million vapors among middle school and high school kids in this country, okay? And I'm going to say that's grossly underreported. Okay, I'm here to say that it is, okay? What we have been seeing, so it worked. So now what the CDC is trying to do and how they're doing it, you don't see any commercials on TV, do you, for vaping or smoking anymore. So how do you think they're getting to the kids and the teenagers?
They're on the radio.
Okay, radio, but what's the big thing? Social media. You get ads on Instagram. You get ads on Snapchat, Facebook saying, hey, buy this, okay? Now, the government, the state of Illinois, fought back and said, hey, we're gonna limit this to you can't buy any tobacco products, including vape pens, until you're 21. You think it worked?
No.
Okay, where there's a will, there's a way. Okay, we all know that from when you were younger. Okay, so what the government now is trying to do is trying to learn from the 1980s. So they're putting out all this sensational stuff on Instagram. What the country's trying to do now is create public service announcements on Instagram, on Facebook, on Snapchat to show the effects of this to the kids, because kids don't learn by a lecture. Kids learn by actually seeing something. Okay, they are visual learners in their growth and development. Okay, so that is, I think, what I can say to all of you is that smoking and vaping does not discriminate. Okay, boys, girls, white, black, Hispanic, age range, very popular in the young adult, but it does not discriminate. It's there in the wealthy, it's there in the lower socioeconomic status, it's everywhere. And I would really, really encourage you to get on YouTube, to get on your social media and show those public service announcements to your kids. That is what will grab their attention the most. Okay? In the ER, we've seen a couple cases of side effects from vaping. Yesterday, we just admitted a 16-year-old girl with a collapsed lung, okay, from chronic vaping. Does everybody know what your lungs do? You kids have these gorgeous pink organs in your chest that help you breathe in and out, and we want them to stay pink. Well, hers collapsed because she had so much fluid in her lung that her lung didn't have enough space in that area to expand and contract or breathe, and it collapsed. Think about putting too much air in a balloon. That's the same thing that happens with your lung, okay? She now has a large tube in the side of her chest to drain all that fluid and air out of her lungs so that hopefully it recovers. But she's already showing signs of scarring on that, okay? Thank you.
Well, that was a scary way to end, but it was very important.
They took my other stuff.
Yes, that's how I feel. Don't worry. Keep going.
So I will switch it up a little, and I wanted to talk about the initiatives of the health department because I was hoping that more people would talk about, the effects of vaping and the harms. But I do have some follow-up topics that I want to discuss. So first, I'll just start with introducing myself. So my name is Maria Hagel, and I work at the Kane County Health Department. I'm the tobacco program coordinator there. My education, I received my undergraduate degree at the University of Illinois in interdisciplinary health studies. And then after that, I received my master's in public health from the Northern Illinois University. And like I said, I'm currently the tobacco program coordinator at the health department, and I also run the Kane County Tobacco Control Coalition. I'm also an adjunct professor at NIU, and I teach undergraduate epidemiology there. So it's just some follow-up stuff. I mean, the reason that vaping is so common in youth and it's so popular and so widely utilized is basically because of three things. One is the marketing of e-cigarettes to youth, as we discussed. And while this marketing has decreased because the CDC and the FDA have found that they were marketing to youth and that was not what was intended. It was supposed to be a product to stop adults from smoking cigarettes. That's what they were saying that it was. That's how they were putting this on the market. But what they were secretly doing, or not so secretly, it was marketing to youth and using colors and age groups. It wasn't, that people in the commercials weren't 40-year-olds. They were 21. People meant to look like they were in their teens or like young adults. And so now that marketing has stopped on commercials and in TV, but that doesn't stop what is happening on social media. Celebrities have it in their hand in every photo, are taking videos with it all the time. I was looking at pictures of Adele on my Instagram, and she's just holding it in every picture and just using it, and it's just so commonly utilized and glamorized, this amazing product. And for adults, it might help with smoking cessation, but that has nothing to do with youth, and that is not a good explanation for why youth would be using it. So the marketing was one main factor. Another one was the appealing flavors. So, having something that tastes like mangoes, everybody who's tried a cigarette knows that it's not delicious and that it's not fun and that it's not that nice to use. But something that tastes like mangoes, inhaling that, enjoying that, plus the high of nicotine, that is definitely a wonderful product then for somebody to become addicted to. So definitely the appealing flavors that are for youth. But one thing I wanted to add about that is, so the FDA is supposed to regulate e-cigarettes and vaping products. Nothing to do with THC because that's not federally legal, so they can't have any, that's illegal, so they have no regulation over that. But nicotine products, they are supposed to regulate. In 2016, it was defined under their tobacco products, so they were supposed to regulate what's in them and have jurisdiction over that. Really, the regulation didn't start until January 2020, so last month, when they actually took all cartridges that were flavored, so any Juul pods or any kind of cartridge-based e-cigarette, they took all the flavored ones off the market except for menthol and tobacco. So really, you can't see flavored Juul pods anywhere anymore. They're not selling them in stores because they were taken off the market because the FDA had deemed that it was for youth use and not for cessation measures for adults, really. So as they reassessed it, they have been taken off the market. Now, this doesn't include e-liquids, so stuff that you put in actual mods and you create your own liquid and you work on your own level of nicotine in there. This was not included in being taken off the shelves, so those still do exist in stores. And so then the third thing that really affected why you use Juuls and why it rose in popularity is obviously the addiction and the addictive properties of nicotine, the high that you feel when you use nicotine, the brain alteration. So one interesting thing to note is that Juuls are actually made of something called nicotine salt. So this is a different kind of nicotine than what is found in cigarettes. Nicotine salt actually has lower levels of pH, so it's more on the acidic side, but what it does is it makes it easier to be inhaled and it causes less irritation to you when you inhale it. So it's easier to use, and it also gives you like 5% nicotine salts. Like if one of those pods has 5% nicotine salt, that could be like 30 to 50 milligrams of nicotine. So Juul's products, they say that they have as much nicotine in them as one pack of cigarettes. So 20 cigarettes, that's how much nicotine is in just one tiny pod, a Juul pod. And then what else did I want to follow up with? So hospitalizations the rates have definitely slowed down. Actually, the CDC used to report on them once a week, every Thursday. They used to update the numbers when it was at its high in the summer. And now those numbers have slowed down, and the CDC said that they will not continue reporting it weekly, but versus as many more cases come in. But we are still seeing them in Illinois, and even this month there are still cases in Illinois. Now they think the decrease was because this was mostly black market vapes, so people are stopping to either purchase those products or they're just stopping to put the vitamin E acetate in them. But the top counties that had the hospitalizations were Cook County, Kane County, DuPage, Chicago, and Will County with over 10 cases. In total, there was 218 cases in Illinois and around 5 deaths. One more thing that I wanted to follow up with was A good point was brought up about tobacco users. So people who are everyday smokers, 95% of them started before the age of 21, and actually 87% started before the age of 18. So people who are heavy smokers in their adulthood, this is really a habit that has started before the age of 21. So that is really important to note. I mean, the actions that occur before 21 are very much lasting into your future. So this is, juul use and nicotine use right now it's not something that might just fade away. Nicotine is highly addictive and can alter the brain function and brain chemicals for youth, and it's something that could last with them for the rest of their lives. So it's something that really does need to be addressed, immediately when youth are using. Okay, so now going on to more health department initiatives. So we receive a grant from the Illinois Department of Public Health called Illinois Tobacco-Free Communities. So basically our goal with the tobacco program at the health department is to prevent youth from smoking in this county, to reduce secondhand smoke exposure, and this is including vaping secondhand smoke exposure, or secondhand aerosol exposure, and then to promote smoking cessation within the county. And some activities that we do to get this kind of going and to achieve these goals is we provide education on tobacco, vaping, and cessation. We try to create smoke-free policies within the county. So we work really hard to get cities, municipalities to have tobacco 21. And now actually the legal age to buy tobacco is 21 nationwide, but Illinois did have tobacco 21 before it was mandatory nationwide, and Aurora and Elgin also went tobacco 21 before even Illinois did and before most of the rest of the U.S. did. So we are really working hard to make sure that we're upfront with these policies and that we're protecting the youth as much as we can. And then we promote the Illinois Tobacco Quit Line, and actually they just started providing services to youth 13 to 18 and vaping cessation services. So it used to be just smoking cessation services, and they would provide nicotine replacement therapy and help you come up with a quit plan. But now youth can actually text. Anybody 13 to 18 can call the quit line, not text, call the quit line and talk to someone and start a quit plan. Parent permission isn't even required at that point. Further on down, once they have a plan and once, more action starts to take place, then parent permission would be needed. But just to get a consultation and talk about vaping, youth can call the quit line and receive that service. And then we try to enforce the Smoke-Free Illinois Act. So smoking is not legal within facilities where there's employees and people are working, so we try to enforce that if we receive smoking complaints. Currently, you are allowed to vape in facilities, though, depending on what city you live in and what the ordinance is for, the municipality. But Illinois has not included e-cigarette use in the Smoke-Free Illinois Act, but it has included marijuana. So the only thing that's excluded right now is vaping. So basically, unless the building has a policy, everybody's allowed to vape indoors. So that's one thing we want to try to work towards not having and including inside of the Smoke-Free Illinois Act, especially since they just included marijuana too. So we might as well just bundle it all. Another thing we recently did over the past few months is we created a vaping webpage on our health department website. So if you just Google King County Health Department vaping, it should be the first thing that pops up. And it really does have a lot of this information that we've been talking about. What is vaping? We monitor the vaping hospitalizations. Like I said, the CDC have been putting them up every week. So we monitor those numbers and try to update ours as frequently as we can. So it has information about hospitalizations. It has information about cessation services for youth, for adults. And basically, if we don't have it on there, we have a link to somebody that does discuss something about vaping. So if anyone wants more resources, feel free to look at our vaping webpage. Another thing that we did was we tried to work with every school district in King County. There's 9 school districts. So far, we've met with 7 of the 9 school districts to discuss their tobacco policies and their e-cigarette policies, to make sure that everyone is including e-cigarettes in their school policy and saying that that's not allowed on their campuses, as well as talking to the school about what their current problems are, what they're seeing, what their concerns are, and some current efforts that they're doing. So do they have, licensed social workers or some kind of counseling that comes in as some kind of alternative to suspension? Are they working on educating youth about the problems instead of just suspending them once they are caught vaping? So we have been learning a lot from the schools that we've met with on what we could do to improve and how we can try to meet as a community and try to really reduce this problem. Okay, so then the next thing we have is our Kane County Tobacco Control Coalition. So that's made up of those organizations that are on there, and they're also on your e-cigarette informational folders that were on the chairs. So what we did, what we try to do as a group is address tobacco use within Kane County and how we can work on cessation. Basically, everything that I had discussed were the 3 goals in the beginning. We created these e-cigarette informational folders to pass out at events or to families or to schools so that they can really, have the resources that they need to, address this problem. And then, speaking of the e-cigarette informational folders, so what's inside of them is there's local data from the Illinois Youth Survey from 2018. So local data on vaping, how many kids in Kane County really are vaping according to the survey. It could be underreported because not everyone is probably willing to, admit to everything that they're doing. But this is the most accurate data we have locally on what is occurring in this community. And, this is really the way that we can address what's happening is by knowing these numbers and really trying to get a sense of the problem. We also have a vaping cessation contact list. So I've been going to a lot of vaping presentations in the county, and everybody discusses what vaping is and how it's such a concern and how it affects youth, but very little is given to parents about what can you do if your kid is vaping? Where do we go? How do we stop this? What can be done? So we created a vaping cessation contact list. It has text lines for the youth in there that they could just text. It started with the Truth Initiative. They created a text line. So there's a number in there, and if a kid wants to quit vaping, they just text Ditch Juul, and they start giving them messaging and information on how to quit vaping. And there's also services in there for parents. There's call lines. There's phone numbers to connect you to your local hospital, because a lot of them are offering some kind of vaping cessation services. Some are trying to modify even their tobacco cessation programs to also include people who vape and who want to quit that. Then next up we have, I already talked about the infographics, so I don't need to get much more into that, but that's just the data on it, and you all have it in front of you. And then I talked about the cessation contact list, so that is all. Thank you.
Okay, hi everybody. Well, thank you. A lot of really good information. My name is Michelle Werner. I'm a nurse at Linden Oaks, and I was asked to come here and talk a little bit on the panel. So vaping devices are one of the most common form, obviously, used of vaping, of nicotine use among youth, and that's as you were talking about with the YouTubers and the Instagram. Many teens who use the vapes don't even know what's actually in the vape, which is sort of alarming, because it could be THC, it could be nicotine, or you just don't know. Some things it's just the flavoring, and it's they use it because it's easy to hide, so they can put it under their sweatshirt. They can vape in the classroom or in the bathrooms. Right now, they're beginning to look into ways to detect it, and we have a smoke detectors, so to be able to put detectors into the bathrooms. And so teens who are using e-cigarettes are also obviously at greater risk to use cigarettes in the future. Because as was mentioned a little bit earlier, nicotine stimulates the adrenal glands, which releases adrenaline, and that'll stimulate the central nervous system, increases your blood pressure, increases your heart rate, and it activates the brain's reward circuits, which increases dopamine, and that reinforces the rewarding behaviors. So because nicotine affects the development of the brain's reward system, it can lead to not only nicotine addiction, but other substance use, like perhaps methamphetamines or cocaine, and it's more pleasurable to the teen's brain. And it also can affect the development of the brain circuits that control the attention and learning. And other risks would be mood disorders and problems with impulse control. So signs of use would be perhaps they've been having pretty consistent attendance, then all of a sudden their attendance at school sort of dips, their grades go down, you're getting calls from their teachers, perhaps that they're having behaviors that they didn't have before, but so change in behaviors, maybe a friend group change. Maybe they're losing interest in activities. These could also be signs of other things, like perhaps depression, but it could also be signs of some kind of substance use. So what can you do? You want to stay connected to your kids. You want to make sure that you have open line of communication with your kids and listen to them. Sometimes they just need you to listen and not judge them. Know the signs, so know like what their normal is so that you know if they deviate. And if you find something that they say is a flash drive, it's probably not a flash drive. You want to also reward their positive behavior. Perhaps you want to access their cell phones. I'm not sure that might, I know kids might not like that, but you might want to. And maybe some home drug testing. And then Linden Oaks has a program on Mondays for vaping. It's like the first time it's a 90-minute day with the parents, and then there's 3 sessions after that are 60 minutes. So it's like a 4-week program every Monday, and they work with a therapist. So it's like a group. And I think that's all I got.
All right, well, hi, my name is Shannon McCall. I'm from Northwestern Medicine. I'm in the Community Health Services Department there, and I am in charge of all of the tobacco cessation programming that comes out of the West region. I coordinate those programs. I've taught smoking cessation it's been now 20 years. I can't believe I've been talking about smoking for 20 years. But it's true, I have, and now things are changing because we're adding to the tobacco topic, really, e-cigarettes and vaping. And so the hospital offers a variety of different programs for tobacco cessation. We offer a program called Stop Smoking, Clear the Air, which is a 90-minute workshop. And then we also support the Respiratory Health Association's program, Courage to Quit, which is a multi-week support-based program to help people stop smoking. Both of those programs now include stopping vaping and e-cigarette use as well. Because really, all of this is about nicotine addiction. People smoke, they use vapes, they use e-cigarettes, they use combustible tobacco because nicotine is incredibly addictive. It really is ranked as the second most addictive substance out there. No, sorry. My teenager is really worried about when dinner's gonna be. So I'm sorry, I thought I turned it off. But so, second most addictive substance. You guys know what number 1 is? We have it in the morning. Caffeine. Caffeine gets number 1 going, and then nicotine is right after that. And I just want to spend just a couple minutes talking about nicotine addiction and talking about what and why nicotine is so addictive. And really, because in my world and what I've seen in my experience with patients is that it's that addiction that is the problem. And that's what leads to the disease later. So nicotine addiction, it's where to start. Smoking and nicotine, again, incredibly addictive. So a person who's a pack-a-day smoker, let's say, right? So, or a 1 pod a day user, because the equivalent amount of nicotine is in a pack of cigarettes to 1 pod from a Juul. That individual is going to get about 300 balls or blows of nicotine to the brain in a day. So what does that mean? Right? So the brain is getting saturated with nicotine about 300 times a day. So it takes about 7 to 10 seconds for the body to feel the effects of nicotine. So 7 seconds is in there, right about 10 seconds is when it peaks. And when it peaks, it's great. It's a stimulant. It feels good, right? We've heard it all the way down the line. So, but the other thing, the follow-up to nicotine is it dissipates really quick. So dissipate means that it goes away, it dissolves super quick. That's why you puff a cigarette. That's why you puff a vape pen, because in order to get and keep the drug effect working, you've got to have another pump or another blow. Eventually, and what we see with a combustible cigarette is you finish a cigarette and then you're done. People subconsciously, just mentally, are like, oh, I don't want to light another one, or maybe I am going to light another one. But you have to take an action. With the vaping products, it's constant. Like, you can go through an entire pack of cigarettes or worth of nicotine without having to change or do anything different. Like, there's just no end in sight. So that right there is lending us to some additional addiction and addictive behaviors. But so because of the way that the nicotine acts in the brain, you can do a lot of different things with a cigarette or with a vape pen. It's with you a lot. It can be with you when you're bored. It's with you when you're happy. It's with you when you're sad. It's with you when you want, to work on your car. It's with you when you want, it doesn't matter. It's around you all of the time. So we tend to also see not only a physical addiction to nicotine, because we know nicotine is incredibly physically addictive, but then we also have a psychological addiction, because so many behaviors become coupled with the action of using nicotine. So that's why you hear oftentimes that are combustible cigarette users will have their coffee and their cigarette. I have a cigarette, in the morning with my cup of coffee. I have a cigarette in the car when I'm driving. I have a cigarette when I'm, working in the yard. Whatever it is, it tends to couple with many different behaviors. Because of that, and because of the way the brain works, that makes nicotine, cigarette use, and the e-cigarette a very triggered addiction, meaning that you could be doing something that you're not really thinking about smoking or vaping, like having a cup of coffee, and it triggers you wanting that cigarette as well, or wanting whatever it was that you were doing when the individual was vaping. And along with that, and along with what they were saying about the adolescent brain, which makes it even more at risk, and I believe Maria was talking about the stats of when people first started using a combustible cigarette, and we know that youngsters are using, people that are younger, under the age of 25, are using the vape. The way that the human brain develops, the center of the brain, the amygdala, that's where your emotional memories are stored. That's where that part of your brain is just growing at such an incredible rate right now. So that when you couple in that stimulant of the nicotine, that's what kind of links those extra, I don't know, there's probably like a technical term for it that one of you may know and I'm blanking on, but it's what creates that link or that connection that makes it so much more difficult to quit as you go along and as you continue use. So nicotine addiction, really, it's hard. It's hard. People struggle. I've worked with them for years on stopping using cigarettes, and now, over the last year, I've added patients to that, and those patients are now trying to quit vaping. So it's an interesting room now. I'm sitting with my 40 plus and 60 plus patients, and my 24-year-olds and 22-year-olds that are struggling just as much to stop smoking, and you've got the people that have been smoking a pack a day for 20 years having the exact same addiction issues and problems as those individuals that have been vaping for the last 3 years or 4 years. They started when they were in high school, and now they're in college, or they just graduated from school, and they're like, I can't stop. And so the good news is all those that have gone through our program that have been vapors have all been able to stop. So yay. Better news would be don't have to be in one of these programs, right? And it was interesting because the individuals, the older people in the classes are always like, I can't believe young people are starting to vape when we know everything that we know about cigarettes. But it's happening. And so my wanting to be here was just I wanted to make sure that you're all aware that we have that we have resources for individuals that are interested in stopping vaping and also smoking cigarettes. And then along with that, because we are a hospital site, we are a fax referral site for the Illinois Quit Line. So you can call the Quit Line and sign up for that anytime you'd like. There's an 800 number and you can call. We know that sometimes picking up the phone and making that call can be a challenge for people. You know, stopping an addiction isn't easy. And so this removes that onus. We make that referral, and then you give a time range and when you're willing to receive a phone call, and then they'll call you. But it's not like buying a timeshare. They'll call you 3 times, and if you don't answer the phone after those 3 times, then they take you off their list. So, but anyway, that's kind of my spiel there. I hope if you have any questions, you think to ask them.
My name is Karen Webster, and I'm the dental program manager at Tri-City Health Partnership. And pretty much they took almost everything, other than I can just tell you a little bit. It does affect your mouth too, amongst other things, although that probably seems kind of mild compared to lungs. But it's the gateway. I mean, if you're not keeping things healthy, you know, your whole body can go. Very quickly, this is all coming about, like it's changing so fast. It's hard to keep up with. I mean, I learn something new every day on it. But what we do know in dentistry is vaping, they have proven that it's now reducing enamel hardness by 27%. So that's pretty substantial. You know, as your kids get fluoride and sealants and take good care of their teeth, and they're going through no cavity club, guess what? You start vaping, and they weren't knowing what they were putting in those flavors for a while ago. Up until recently when they stopped, you know, allowing the flavors. I'm so happy about that. But I know in the dental world, they said no matter how bad you think it is, it's going to snowball. We're going to see a lot more effects. But right now we're seeing a lot of, there's an increase in oral cancer. We're seeing a lot of oral ulcerations, sore throat, dry mouth. Dry mouth is a big one. Usually kids didn't have problems with dry mouth. That doesn't come until you're an adult and you're on medications, or smokers traditionally have dry mouth. But if you don't have saliva in your mouth to kind of naturally buffer the acids from all the junk food that teenagers like to eat, you talk about cavities happening in a hurry. That's another big one. So it affects everything. When whoever was talking about the public service announcements, remember, just say no. Don't start if you haven't started already. It's nothing but trouble.
Is the enamel issue, is it the flavoring?
I thought it was, but I think it's a combination of everything. And again, we don't know what chemicals are in it. So, and that's your first line of defense. It's hitting those teeth and you're taking it in.
Regardless of whether it's THC or nicotine that they're
I
using?
believe so, yeah. Yep. So. Any other questions? No?
I have a question. Okay, so on the vaping, if, let's say you did find a product that had no nicotine and not the vitamin E mixture, would vaping be, how would you describe vaping then? Still awful for people? Or?
Well, we're talking about kids, right? We're talking about adolescents?
Yeah.
Yes.
So really, the only proven safe thing to inhale is air. Okay, and I do question that sometimes, okay, with what's in the air. So really, it's not just what we have learned from our patients, and these are our teenagers too, is, you know, they'll take some of these empty pods or cartridges and fill them with their own stuff. Stuff that has gasoline in it, mouthwash.
Formaldehyde.
formaldehyde, hairspray, products around the house to try to initiate a high, okay? So it doesn't matter if, and really, they have said even those cartridges that say there's no nicotine in them, they still contain trace amounts and everything. But it's not just the nicotine it contains, it's all the chemicals that go into it to make it able to go through that process, that heating process inside a cartridge to be able to be inhaled. So
I was going to add to that, just when you, because even if they say what's in that product, when you heat it, it changes.
Yeah.
You just think about, high school chemistry class,
Yeah.
or when you heat something, it changes. And so I think that's another reason they're having a hard time tracking long-term effects, because every compound's different, every pod's different in what it has, and then it all changes when you inhale it. So it's like, it's very hard. I think that's why the science is it's hard to keep up with all of it, because it's changing all the time.
And then another example, so let's say it has no nicotine at all, but one popular flavor used to be like a buttery popcorn flavor. So I don't know how many people have heard of popcorn lung, but there was factory workers who were working on creating popcorn, and the popcorn flavoring all of a sudden started to see that their lungs were irritated and started having some difficulty with lung problems. And what they found out was that this diacetyl that was used in creating buttery popcorn flavor, which is totally okay for you to eat, actually has a really negative effect on your lungs when you inhale it. So now you'll see images of people who work in these popcorn factories and are slathering everything in the butter. They'll have ventilation masks and they'll be fully masked. So now they were putting this product inside of vaping devices to flavor it like a buttery flavor. And so this is what the youth were inhaling and what adults were inhaling. So now that one's not as commonly used, but there could be multiple examples of this. You just never know what is put in them to give them these flavors, this taste, and that effect that it has on you. And again, when it's burned, it has a different reaction. They talk about the ultra-fine particles that are in them. They really are saying that secondhand aerosol does have negative effects and can affect lungs and can have toxicity effects, because you don't really know what is being heated and what is being expelled. And this is something that other people could be inhaling and that you yourself are inhaling when you use it. And just the effects and it's not known really what it is yet, but it can't be air, so it's not that great.
What is the effect of like secondhand? Like you have secondhand smoke. Is there secondhand like vaping? I mean, obviously you're not doing it, but you're around kids that are doing it. What's the effect of that?
So, as far as I know, the effects aren't fully known, but they are saying there are effects, and there could be effects to lungs.
Well, that's what you're saying, that it's just that's the misconception that e-cigarettes or vapes let off water vapor, which is not actually the case. It lets off the combustion materials of whatever is in that cartridge. So it really depends on whatever happens when you burn whatever is in that cartridge. So a lot of them have various preservative, antifreeze elements, different chemicals in there to make it look a certain way, make it smell a certain way, make it taste a certain way, and then you burn those, and then that is going off into the air like a pollution, like a smog. Like you'd be in a big city, you don't know what's coming out of the exhausts of factories and cars. It's the same idea. Things are being burned, they're letting off byproducts. What those are, nobody really knows.
And I think it's probably really important to, when we make the comparison between a combustible cigarette and the vaping products that are out there, we know a lot about tobacco products, a combustible cigarette, because it's been around a long time and we have studied it. So we know that smoking a combustible cigarette is the #1 cause of preventable death in our nation. It is still the #1 reason why people die in our country. What I think is shocking to a lot of people is secondhand smoke of a combustible cigarette is the 3rd leading cause of death in our nation. So we really could take this as that is a big warning sign when we look at these e-cigarette products. There's so much that we don't know. I mean, it's echoed up and down this panel. There's so much that we don't know. The risk isn't worth the investment in using this product when it comes to adolescents at all. And really for adults that are non-tobacco users. I think the jury's still out about those individuals that are using a combustible cigarette and are unable to quit. and using a vaping as a cessation method. The jury's still out on that. But again, we do know some really harmful things about tobacco, and it probably can make some common sense correlations, but we don't have evidence yet because it's just too new.
And then one more thing I wanted to add. So 2 main ingredients that are found in e-cigarettes, other than like let's say nicotine or THC, are propylene glycol and vegetable glycerin. So propylene glycol helps with the flavoring of the e-cigarette, and then the vegetable glycerin helps with, depending on how much you add, with how the puff of the e-cigarette feels and what kind of a puff it has. So these 2 products, according to the American Lung Association, exposure to is likely to expose users to high levels of toxin. So just even being exposed to these 2 products, once they have turned into that aerosol, leads to high levels of exposures to toxins. So that is something that is important to keep in mind. So, you know, even if it is 100% nicotine-free, there are definitely concerns.
Is this question?
Yeah. Who says?
So you mentioned that they stopped the flavored cartridge liquids. How come the other ways, you know, the other liquids have not followed that? What makes them different?
So
And
the
why not?
FDA is a government organization, and sometimes the process for getting all the government stuff regulated is probably very long. But I think the reason that they started with cartridges is because they were finding that this is what youth are using right now, and it's causing a very large concern. So they took it off the markets because they saw that this wasn't for adult cessation use, this was for youth use, and they immediately were able to gauge that. And I think that the goal is, that everything has to be reviewed by the FDA and then put back into the market for approval once they deem it as okay. I don't think that they're there yet, but I think that the goal is for them to be there.
Yeah. Because that was what the kids, they have researched that more kids use that style.
Yeah, and then now that Juul is out,
And Juul was noted to be one of the most popular among teens, and so that's why they went after Juul first. And Juul had a huge lawsuit, and so that's why they, Juul, and I'm going to tell you, Juul's doing a great job of marketing themselves as, look, we took away all the bad stuff. We took away the flavors. You just had tobacco and menthol, right? And everything. So we're okay. They're not okay. They don't care about any of you. They don't care about the smokers that want to quit by, doing the healthy alternative, which is not healthy. And then kids heard healthy alternative to smoking, and all they heard was healthy. So they thought, this is healthy, I'm going to do it. That's how they got into everyone's heads and marketed themselves that way. So don't be fooled and don't let them win.
And I was thinking too, I always, when I'm talking to kids about this, I'm like, okay, if they can make a product that's super addictive and say it has no nicotine in it, you think they're really, they're out to make money. So I'm going to say this has no nicotine in it, so now you're hooked because, right, it's number 2 as far as most difficult to remove yourself from once you are in an addictive pattern. And so I'm going to tell you it has nothing in it because a lot of the kids will think this doesn't have any nicotine in it, so it's okay. Yes, okay, yeah.
Because it makes sense.
Why would you sell something that you can make them addicted to?
Why would a teenager even bother smoking or doing a vape if they got no payoff?
But that not knowing
and
that
thinking it's healthy, and then the organization that makes it, they want to keep you coming back. So of course they
do.
Put something in it that's going to be addictive.
You're not going to sell cookies that taste bad, right?
They care about their bank account, not your lungs.
Well, and I also believe Juul's owned by a big
35% of it's owned by Altria, who owns Philip Morris.
I was just going to say Philip Morris.
Well, I
$20 billion industry.
I have a question about the public policy where you mentioned that the state of Illinois has put in where smoking marijuana in public is not allowed, and they did that pretty quickly. Why haven't they done that with these cigarettes yet?
Politics. what the problem is, so they have introduced it. It's in the legislative session right now too. So they have introduced it. They're having a difficult time defining e-cigarettes, and making this a definition that sticks and that there's not loopholes. So there's been issues with either people who are opposing putting it in the definition, or actually last time around it was actually the organizations that are for adding e-cigarettes into the Smoke-Free Illinois Act. They didn't like the way it was defined. There could be loopholes or new products, like if there's disposable products now which are coming into popularity and other stuff. They really wanted to make sure that this was a strong definition, so they have been putting it off, or then there's the voting of it and who approves it. So it's just been in cycles for the past few years.
It almost seems like they just need to put some wording in.
And the marijuana one did come fast.
Right, and then understand that, it's going to change. I mean, everybody's going to find the loopholes, and as quickly as they got the marijuana in, let's get these new other names and brands and change the policy. It can't be that hard. I mean...
So what is the title of the policy? So like if we write our congressman or something, what is the...
So it's the Smoke-Free Illinois Act, and then it's Senate Bill 1863 or 69.
You can Google it. Yeah, you can.
But it's the Smoke-Free Illinois.
And it's in this, and it would be a Senate bill?
Yeah, I think it's a Senate bill, and it's going through like a House committee right now. And actually, there was I think a voting on it this week to pass through like a committee.
And they're in session through May.
Yeah, so we'll see what happens. And again, it's all of the factors that we discussed. So we don't know what the effects of the aerosol yet. We don't really know the effects of it. So there is an argument. Well, if you don't know the effects, why shouldn't people be allowed to use it indoors? When I think that's how some people might be seeing it. When really,
I mean, I have to say I haven't seen it too much. I don't think I've ever seen anybody smoke it indoors, but.
It's very easy to hide though. It's very hard to see a lot of times it's very hard to see the vapor. You can hold it in your hand and just be like, smell. Yeah.
But the smell is so...
No, not all of them smell.
Yeah, not like to smell like
in stores, I can smell that sweet.
Yeah.
Right,
sweetness.
right. But not all of them smell.
And now they make them so that the smoke is not. They used to make, when they first came out, like people were doing these crazy smoke things.
Not that way.
It was cool to like be able to blow like a certain barrel shooting smoke. But now they have very minimal to no smoke coming out because they want them to be able to be hidden.
Yeah, they were invented to mimic a cigarette. So the first generation, they looked like cigarettes. They were like the size of a pen. They were white. They had a little brown thing on them. They put out a really visible smoke stream, and because that's what they were original was, they were trying to woo smokers into this healthy alternative to smoking. And now that younger people have become much more enamored with it, now it's gone to as being as hidden as possible. Yeah. How can we make it look as little like a cigarette as possible with as little bit of a footprint? Make it small, make it look inconspicuous, make it look like something that a kid might have in their bag, make it so nobody can smell it when they're doing it, make it so they can do it in the bathroom and nobody can sense it. Now it's all about being hidden.
So is it a better alternative, like adults who smoke, is it better to not smoke and vape?
It was created originally as the healthy alternative because it contains less amounts of nicotine and no tar.
Okay.
So technically it was marketed that it's better for your lungs and everything, but what they're finding is it's not stopping the addiction process and everything, so people are still addicted to it. So I have lots of kids that say, well, my parents stopped smoking and they're vaping now, but that's better because it doesn't have the tar. Well, yes, but it doesn't stop the addiction process, and then now you have all these new chemicals going into your lung that are equally bad. You're distributing the bad.
And you could probably go through a pod in one day where you're having a pack of cigarettes.
Because like she said before, there's no end.
But nothing is more dangerous than cigarettes.
Yeah,
nothing is more dangerous than cigarettes.
The Surgeon General came out in 2018. The Surgeon General, it's actually a fascinating report if you like those sort of things. But listening to the Surgeon General talk in 2018, he came forth and said, here's what their plan is for tobacco. And the plan is that we want everyone to stop smoking. It's really bad for you. It's killing our nation. So we suggest that you quit. If you can't quit on your own, you should use an FDA-approved method for cessation, something like the patch, the gum, the lozenge, there's a nasal spray, maybe a pharmaceutical option like Chantix or Wellbutrin. Those things that's researched and they work. If you're still not willing to quit using those, then you should probably try to vape, because you know for sure the cigarette you're smoking will kill you, and it's likely to kill the people around you that you smoke. But we really don't have any idea what's going to happen with the vape. So that's kind of it. If you're a betting person, that would be your odd. But that doesn't go for young people. And again, that's only for already tobacco users.
Two questions, actually. What's the implications for asthmatics? Are they just more likely to get the lung issues?
Yeah, so of the outbreak that we saw last summer of the vaping-associated lung disease, about 30% of deaths were associated with asthmatics. So there is a high correlation between asthmatics and acute lung damage from vaping. And again, asthmatics generally should not be inhaling aerosolized particulates. Like asthmatics and aerosolized hairspray, cooking spray have higher incidence of lung disease just from everyday aerosolized irritants. So yeah, it's a bad combination.
And the other question is a parenting question, and I'm interested in your opinions. I know you talked about support, but what's your opinion on just trying to hold a hard line in a family and saying no vaping, no drugs, we'll randomly test?
Can I comment on that? Okay. There was the DARE program that came out. Yeah. I'm a product of the DARE program, I think why the DARE program shows that it did not work is like we said just to say no to it. However, we live in a world that kids are curious. Right. They're curious. So Joey down the street does it, or Tommy, or Susie Q, or whoever, and they're fine. So why can't you be fine with this, right? So I think you can have this is not permitted in my home. Absolutely, that's your home. You have that's your rules in there apply. I think. I have caution with leading with the drug test, because I'm trying to catch you after the fact instead of trying to have a conversation with you before you use, or you just used for the first time, and now I'm trying to see what was that about. What made you curious about it? What changed for you? Do we know how this could do it? We know that we can't scare kids straight. That does not work. That was the DARE program. This is your brain on drugs with the egg in the frying pan and stuff. It's, adolescent brains aren't developed enough to be able to forecast. Well, smoking can kill you when you're 80. I'm 14. A long time. It's fine. It's no big deal, right? Because they just don't. Their brains are not developed enough to have that capacity. So I think absolutely it could be no drugs, no alcohol, no vaping products, for sure. However, if you see these things, if you're tempted to use these things, talk to me about it. Instead of saying, oh, I'm kind of thinking about using it. Because usually when I meet with kids, they've been thinking about using something like that before they use it for, a good amount of time. And then they used it. And then they use it again. And now I have teenagers that I see that want to stop vaping. And they are just struggling like crazy. Their ability to control their anger, their impulsivity is so high. They're having trouble sleeping. They're sweating. It's awful. And then they're hiding that from their parent, because I don't want them to know that I vaped, and now I'm trying to stop, and I'm screaming at my parents all the time because I'm so agitated. If you ever known anybody who tried to stop smoking, they get pretty agitated. It's like times 10. And it's an adolescent brain, so it's just kind of all over the place. So I think saying, if you do try these things, I need you to come to me. I don't want to have to go and test for it after the fact. And I think looking at those observed behaviors is a great way to start. What's going on? It seems like you're having a lot more trouble sleeping at night. You're not eating as much, or been hanging around with a lot of new people. What's that about? Because I think that's the best way you can be preventative and proactive and kind of moving away those products from your children, because they are going to be around people who are going to use them. That's pretty much, I can't predict the future, but I'm like 99.9% sure that they're going to be around somebody using this at some point, you know. And so what do you do when that happens? What are you going to do when you see Susie Q smoking a vape? Like, what's that going to be like for you? Have those conversations now. It's not going to hurt him.
And actually, there's parent resources on the web through, I know, like the Respiratory Health Association, the American Lung Association, the CDC, the Catch program. It's called Be Vape Free. They all have tabs that are how as a parent do you have a conversation with your kids about vaping. So I would strongly encourage you to look at those resources there as well. And then just to share a story that is not Northwestern Medicine related, just me as a parent of 2 adult children and 2 teenagers. For my adult children, when it came to drug tests and having them in the house when they were teenagers, we always had them in the house, and we had them more as a way to say to our kids, you will be the bad guys. We're the bad guys. I don't care if your friends think that I'm a nuts parent and I'm going to drug test you. If you're in a situation where somebody's saying to you that you should drink or smoke pot or smoke tobacco, you can say to them, I can't. My parents will drug test me when I get home and I'll be grounded forever. So I used that in a much different way, because there's a lot of peer pressure out there to want to be able, I mean, we were all teenagers once, and there's teenagers in this room. Everybody wants to be liked and be a part of something, so sometimes being...
I would say it's completely okay to set limits, but don't end it there. Allow the questions to be asked. Allow like two-way conversation and open-ended communication. I think you'll have a lot more success that way then with your limits. Yeah.
Okay, what I'd like to do, just for the sake of time, is there's still another part of this that I think would be beneficial for those of you who are wanting to see some of these people individually. They have supports and resources to offer you individually. Obviously, you can exchange emails and email other questions that you might have at this time. But Officer Goshi has some really cool things to look at, obviously, so you can make yourself very aware of what these things are looking at, what these teenagers and students are, seeing every day with their peers, what they're potentially bringing into our schools and passing around. So at this time, I'm going to ask that we transition into the cafeteria. Please take a walk around just to kind of see some of the stuff that they have for you. Thank you all for coming.